Hi, my name is Jessica Granger and I'm with the University of Texas Arlington School of Nursing. Today I'm going to speak with you about sepsis and septic shock in the emergency department. This course is a lecture-style course for practicing registered nurses already working in an emergency department. The ages of the student will be between 21 years of age and retirement. At the end of this course, students will be able to define the term sepsis, septic shock, and will also be able to define SEERS and QSOFA. Students will also be able to verbalize 4 early warning signs and symptoms of patients with sepsis and 3 different medications or treatments for the treatment of sepsis. Okay, let's get started. First, we need to discuss what exactly is sepsis and what makes sepsis turn into septic shock. Recently, the American Medical Association looked into redefining the term sepsis because there was a lot of confusion out there as to sepsis, severe sepsis, septicemia. Many terms are being used to describe one condition. They then came to a consensus that the definition for sepsis is a life-threatening organ dysfunction due to dysregulated host response to an infection. Basically, any infection in your body can be localized or it can spread throughout your body. Whenever it spreads throughout your blood into your system causing organ dysfunction, that is what sepsis is. Most sepsis is bacterial infections, though it can be viral and fungal. What is septic shock? Septic shock is the presence of sepsis, so it's bacteria or an infection going through your bloodstream in your body affecting your organs that causes circulatory compromise. So what exactly happens during sepsis? So the bacteria, the infection that a host has, as it's going through the body, many times it releases endotoxins. These endotoxins then cause vasodilation in your blood vessels, which then causes hypotension. Hypotension leads to hypoxia of your vital organs and tissues, which then leads to circulatory compromise. One of the first systems that is affected is your renal system. And for patients in sepsis, you will see a decrease in urine output. You will also see a temperature rise as a fever is established with the initial infection. Respiratory rate also increases as the patient is developing an acidosis to try to create a balance in their pH. Clotting formation also forms due to the extensive inflammatory process, and little clots can go throughout the body and also cause small anoxic injuries or infarctions to different tissues and organs, which also can lead to disseminated intravascular coagulation. It's basically one big train wreck, right? So what are the statistics? Like, how often does this happen? It's actually one of the leading causes of death in intensive care units throughout the United States, and over 1 million patients experience sepsis every single year in the US. One of the things that the College of Emergency Physicians has come up with is a screening tool to detect patients that are at risk for developing septic shock and increased mortality, to assist caregivers in identifying the patients that could get sepsis, and then what to do about it. So the first thing, obviously, is finding out, are these patients at risk for developing sepsis? The tool is called the DART tool, D-A-R-T. D stands for detection, A stands for act, R stands for reassess, and T stands for titrate. So let's talk about detection. Detection, for many years, we have used the SEERS criteria. It's the Systemic Inflammatory Response Syndrome, where clinicians take into account temperature, heart rate, respiratory rate, and if you have lab work back, WBCs. This criteria is used to establish if a patient is at risk for sepsis or not. Recently, the QSOFA has come into play and is being suggested from the American Medical Association as the detection tool that should be used in non-intensive care units for establishing whether or not a patient is truly at risk for an increased mortality. The QSOFA, it's a QSOFA. It has, the components of it is the GCS, which is the Glasgow Coma Scale, systolic blood pressure, and respiratory rate. If you have the ability to get lab work back, lactate levels are also involved in it, but it's not necessary to receive a score. Using either one of these two tools, clinicians are able to establish if a patient is at risk for sepsis. So the next letter in the tool to how to treat patients with sepsis is A, ACT. It is very important that you are able to do volume replacement on these patients, as hypotension is one of the causes of increased mortality. The recommendation is a crystalloid bolus. Typically it's normal saline, but it could be lactated Ringers, and early administration of antibiotics. To do both of these, you will have to establish peripheral IV lines and also get all cultures of suspected source of infection prior to administration of antibiotics. The time is ticking. Most emergency departments have a goal set of door to antibiotic time of less than 90 minutes, whereas some are more aggressive and it's less than 60 minutes. This helps increase the patient's chances of not having long-term effects if they are being able to be successfully treated for sepsis. The third component of the DART tool is reassess. Constantly reassess your patient's status, including vital signs and lactate levels, to see if there's an improvement in the patient's condition. Also, there's a recommendation to get a CVP, a central venous pressure measurement. This measurement allows the practitioner to know if the hypotension is due to the need for a volume replacement versus vasopressors. If those endotoxins are causing vasodilation, but the patient is adequately hydrated, then we know we need to start on vasopressors. The fourth component of the DART tool is titrate. This is where you would address the hypotension. If there is the hypotension, like I just discussed, and it's not due to dehydration status, you would need to start on vasopressors with constant monitoring. Also, continuously monitoring renal output so that you can do volume replacement as needed. So in this module, your objectives that you were supposed to learn were to define sepsis versus septic shock, which sepsis is the life-threatening organ dysfunction due to dysregulated host response to an infection, and septic shock is sepsis, but with circulatory compromise. We were also supposed to discuss 4 early signs and symptoms. So just in review, elevated temperature, heart rate, respiratory rate, hypotension. Those are all signs and symptoms that could be seen in an early stage for you to detect a patient with sepsis. And of course, keep in mind, all of these with the presence of a suspected infection. The third objective that we were to learn today was the 3 medications and treatments used. So, crystalloid bolus is the number 1 with antibiotic administration. Number 2. Number 3 would be to be giving vasopressors as needed for hypotension that was caused from the release of endotoxins in the bacteria. At this time, I will open it up for any questions that any of you guys have for clarification. We also will do a discussion of a case topic, case study, and following that, we will take a 25-question quiz to see what you learned and to see if we need to clarify anything any further. Thank you for your time, and I look forward to discussing sepsis with you. Have a great day.